Okay, let's get underway. Hi, my name is Phil Corbell. I'm one of the co-founders of the Carbon Literacy Project and its Director of Advocacy. Thanks for joining us at this lunchtime session of our Healthcare Day. It's part of a fortnight season of showcases for the extraordinary range of work that's going on in carbon literacy, sort of everywhere, really. But today, obviously, looking at healthcare. What we'll be doing is having a panel discussion looking at the role of staff engagement in climate action in the NHS. It's going to be a fairly open panel discussion, so please feel free to put questions, preferably in the Q&A button at the bottom of your screen. We'll try to answer those as we go along. This is also being recorded, as you probably saw and heard the voice, the Zoom button telling you that. I hope that's all right with you as well. Without further ado, let's introduce those members of the panel that have made it to us so far. Let's introduce Alexis first. Alexis, could you reveal yourself, as it were? Hi, Alexis. With the cat, as expected as well. And feel free to unmute yourself as well. That'd be great. Great.
Afternoon, everyone.
Hi, Alexis. You've got your stripes behind you as well.
Well, it's an obvious thing. You have to have the climate stripes at this present moment in time.
You did. Tell us more about your association with stripes before we get into the...
Well,
I followed you on Twitter. God.
Yeah, I have created a climate stripe battle dress for various different things. COP26 battle bus that I was at, and I was up at COP26 yesterday, so it's kind of working its way around the UK at the moment.
Fantastic, and everyone's sort of following you as well. You know, no, but marvelous stuff. Alexis, what do you do? Tell us who you work for officially and what you're doing at the moment.
So I work for Yorkshire Ambulance Service. I'm the Environmental and Sustainability Manager, but I'm also the Net Zero Climate Change Lead for the ICS in Humber Coast and Vale, and working to drive down carbon emissions predominantly from the ambulance service across the UK, and working with international partners as well. Yeah,
so not much on your plate then.
No, not much.
Good. Let's go to Salford. Nicholas, please join us. That's great. Nicholas, if you could introduce yourself, that'd be fantastic.
Hi, Phil. Thanks very much. So, yes, I'm Nick Browne. I'm a GP in Salford. I also work for the CCG and the Joint Social Values Lead, and part of that remit is obviously environmental, looking at the environmental aspect of that. So one of the key things we're doing is really trying to identify how Salford can reach its net zero target of 2038. So we're working with the council as well. We're also trying to work with the university and the hospitals, as well as the GPs. So yeah, really trying to get everybody involved in the whole of Salford so that we're all working in the same way.
Yeah, and the day job as well.
So GP, yes, I'm a GP in a GP practice in Walkden in Salford. So yeah, that keeps me quite busy at the moment. But I'm also trying to do my bit of the practice as well by kind of leading from the front. So, you know, trying to really instill kind of the green agenda within the practice, general basic stuff, but really trying to show how it can be done at the front line as well.
Yes, absolutely. We're hoping to also be joined by Karen Aguilera, who's apparently stuck in the lobby. We're going to try to get you out the lobby in the off chance you can hear us, Karen. Karen from Northwest Ambulance. But in the way of these things, I think we better crack on. And the theme of this discussion is the rationale for staff engagement on net zero and the NHS. So I was wondering, for both of your idea on the level of staff engagement and motivation on the climate agenda within your parts of the NHS so far. Alexis, if you could start.
I think, I mean, having been in sustainability for 12 years within the NHS, the past few years, it's had a massive increase in the amount of people that are interested in sustainability stuff, and climate change has creeped up and then just galloped ahead with the realms of Doctors for Extinction Rebellion, Health Declares, Pharmacy Declares, all the various networks supported by Centre for Sustainable Healthcare. But there is a glaring gap in the knowledge of climate change and the connectivity with planetary health, and how the two are meshed together. And this fills the gap in kind of getting people connected to how climate change actually has a direct impact on their patients, not patients that are in Africa, but it's the patients on their doorstep. So I think for a lot of people, they're suddenly becoming very aware of it, and it's how we can kind of build on that momentum that is growing quite rapidly, really.
Great, that's really good to hear. Nicholas, is that a similar picture that you're getting in primary care and with the CCG?
Yeah, definitely. I think, everyone's on their own journey, aren't there? And some people are much further along. And as you start just talking to people about it, you realise that that's the variability of their journey. And also, I think it's the language that we use, that those who are further along may have an understanding and a concept of, carbon footprint and equivalent CO2, and also start having an idea of the currency as well. What has a big carbon footprint? What has a small carbon footprint? What things can I do that have more of an impact? And you speak to people, there isn't that kind of depth or breadth of understanding, and it's trying to help people to get up to that level.
Yeah, which is a strong parallel to our experience. I mean, we launched in 2012, and I think the need to explain the phenomenon and do that first bit of here's climate change, this is the greenhouse effect, ... It's definitely shifted, and we're getting more towards, okay, yeah, I've heard about this, it might matter, and moving it into that crucial moment of I have to act, and here are some things we can do. I'm getting nods from Alexis and nods from Nick. Would you care to elaborate, or have I done it? Have I completed that better?
I think there's for so long it's been one of those things that it's been laden on estates and fleet teams to sort it out. And now when we start talking about metered dose inhalers or desflurane use, or looking at stuff that isn't in the realms of estates and fleet, that's where the engagement is suddenly kind of come on leaps and bounds, because that's where the carbon footprint is. It's in the procurement, it's the use, the consumption. It's not just about changing the buildings into a net zero building, because that's not what the NHS is about. It's about the people, it's about the consumption, it's about how we carry on as an organisation. So we're still very much at the beginning of this journey, but I think for a lot of people, it's how we progress forward. And the wonderful Karen has managed to get in.
Yes, fantastic. You spotted her before we did.
I'm so sorry.
Oh, Karen, we've been living this. We've been doing this since last Monday. You're not alone. I can't stress enough, but really good to see you. Karen, if you could just introduce yourself, then we'll bring you into the discussion.
So I'm Karen Aguilera. I'm Environmental Sustainability Officer at the North West Ambulance Service.
Fantastic. Thank you very much. And thanks for persevering with the glories of Zoom. But we were talking about that shift in awareness now, in general awareness within the NHS staff body, hopefully from it being a bit, yeah, we know, and it's something we ought to think about, to actually it being actually on the ground. No, this is a health issue, and not just a general health issue, it's something that affects my organisation and my colleagues. Is that something that you're feeling happening at North West Ambulance, Karen?
Absolutely, yeah. So a lot of the conversations that we have at senior levels are very much around health impacts. And once we started talking in health impacts and not just about environmental impacts, then that's when people start to listen, because they're ultimately in the job because they care about people and the health of the communities that we serve. Fantastic.
And I'm wondering if there's an issue of, we're sort of alluding to it already, that it's moved from other to us in terms of its level of relevance within the broader perception. And I'm talking very much before we get into the nitty gritty of carbon literacy itself. Nicholas, do you think that is actually happening, landing with some people?
So I suppose, yeah, on a personal level and on an organisational level as well. And I think that's the thing. It can be like I think Alexis was saying. Sometimes it's like, well, what's it got to do with me? You know, I'm trying to deliver I'm a GP. What's that got to do with me? So suddenly starting to see how it is to do with me and my job, and getting my staff in a primary care to understand that as our activity and what the benefits would be to our patients. So then as a commissioner, to start thinking, well, what can that do as a commissioner? Where do I come into this? Surely it's got nothing to do with me. But then you start realizing that actually, you know, when I'm speaking to some of the hospital colleagues and we're developing new pathways, how can we introduce the carbon footprint on the accounting ledger, not just the money? And so actually when we start talking about how do we develop that new outpatient service, how do we look at what carbon footprint this new outpatient service will have compared to the old one? And as we twinker it, how does that affect that carbon ledger in the spreadsheet, to start realizing that that's one of the calculations we need to start making?
I'm really glad you brought that up, Nicholas, because within carbon literacy training, certainly one of the places where we consistently see the light go on is talking about co-benefits. And almost it's something in my job when I'm introducing people to sometimes to the agenda, let alone carbon literacy, again, it's getting it through to people on their level. It's that, as we know, the frame of people's existing priorities and values. But do you think, certainly on commissioning, and all of you are involved in the spend discussion, that there's a notion of the value of co-benefits, that actually it's not just about lessening the impacts of the climate crisis, that actually the value to the service, to the organization or organizations, is tangible and plays into the decisions to spend?
Well, yeah, I mean, some of the discussions we've had with local hospitals is about, you know, how can we sell this as, do you know what, if we do that, we're going to get lower carbon footprint, but you know, it's just going to save you money as well. Yep. And actually, the more you do it, so, you know, one of the key things at the moment in the practice, just switching over to LED lights, the calculation is actually from that, what will we save per year? And you suddenly realize, wow, we'll recoup that cost within 3 or 4 years, and then it's win-win after that. Yep. And it just becomes a no-brainer. You know, so there is a bit. I think the honest truth is also there's going to be a bit of a cost involved. You know, some things are more expensive. Just switching over some kind of, you know, stationery to more environmentally friendly stationery might be slightly more expensive, but maybe some of that's just down to the fact that the supply issue isn't out there. As we all switch to it, it's going to become the norm, the default, rather than the exception.
And prices come down, etc. We're not going to go down a huge procurement discussion, fascinating as it is. Okay, I'm a layman. My perception of the NHS is a very command and control thing. You know, you have precise procedures that people just have to follow, that people are used to being told what to do and getting on with it. Yeah. What do you perceive as the difference between colleagues understanding why they're being asked to do something and just being told follow this manual on these steps? Alexis, if we could bring you in on that.
I think what this is doing through everything we're doing at the moment with climate change education is empowering people to actually question everything and push back and say, I know that's the way we've always done it, and I know infection prevention control leads, that's the way we've always done it, but I'm going to challenge you, and I'm going to say we're going to go for a reusable face mask. We're going to look at the way we procure various different things. We're going to challenge, well, why are we still doing that? And I think if they have the kind of power as to why we need to do it, it then becomes the why are we not doing it? So in many ways, it's very much the engagement process that we need to go through to give people that power to question what we're doing, because we can't carry on, and that's the, you know, there aren't enough resources in the world, and there isn't enough fossil fuels to continue doing this, and there isn't enough carbon sequestration to look at it. So we need to challenge everything through the system.
Karen, do you think the message is getting through within the trust and beyond about the scale and speed of change that the targets require of the NHS?
I think so. There's a lot of centralized work that's been going on in the NHS. So I suppose board leads are getting it from every level at the moment. It's not just the likes of myself and Alexis that are banging the drum lower down, but actually they're being asked by the ICS, they're being asked by the Greener NHS team, they're being asked by NHS Improvement. And this has been going on for a couple of years now, where they've been pushing the green agenda quite hard, and they've been targeting leaders of organisations, which is what's been I suppose, the catalyst for change within the NHS, because previously it was just the likes of me and Alexis banging our little drums and doing the things that perhaps we shouldn't be doing without a little bit more permission to do them, and just kind of getting on and being a little bit, I suppose, intentionally obstructive towards the way that we do things, or the way that we were currently doing things. And basically just getting in the way and making ourselves heard. But we don't, there's less of that now, certainly within NWAS, certainly since we delivered that first pilot, which our Director of Finance was on. We have seen so much movement within the Trust. It's ridiculous. You know, we're a team now that is being, or will be, adequately resourced to be able to deal with this. We're being able to get ourselves properly organised. We're talking about how we embed this across the whole organisation, and not just what policies and procedures we need from the sustainability team. You know, we're looking at all projects over 25 grand. What does that mean from an environmental perspective? You know, what are the carbon implications of these projects? How do we build to net zero? How do we refurb to net zero? You know, these conversations are happening week in, week out now.
And let me, you know, modesty aside, Karen, as the person that led that first training that your finance director participated in, can you trace that shift in culture to that time?
Leadership plays a big role. And I think we were quite lucky in that we had a change of leadership shortly before we even started on the carbon literacy journey. So when we were approached by yourselves, you'll remember the first conversation we had, Phil, where I was like, oh, there's no way I'm going to get a day's worth of learning out of people. I'm not going to get anyone off the road. This is going to be really difficult to get into the organisation. But there was also an opportunity. We had a new Director of Finance, we had a new Chief Exec, and we kind of had to bang the drum a little bit louder, because they'd just come into the organisation, and be really transparent about where we were and where we were lacking and what needed to happen. And carbon literacy helped us explain that. Certainly in the first pilot, it helped us explain the scale of the issue and the impacts in the long run if we continue to operate the way that we're operating.
Nicholas, as well as Karen being a trainer, Nicholas, you were a trainer too, running the first carbon literacy training for primary care. Can you, it feels like everything pre-pandemic, so long ago, but can you recall that sense of impact? I think you did it over 2 half-day sessions at the CCG offices. Can you recall that sense of impact amongst your learner group as it went through? Or I think there
was an initial sense of either kind of like, what's it got to do with us? I've been told to come here. To also some people keen to come here, but just feeling very overwhelmed by the whole issue, and they couldn't see the wood for the trees, as it were. And I think it just helped clarify things. I think what was also interesting is from that as well is wider. I think the discussions, it felt that there was a tipping point, and the tipping point occurred on 2 levels. One, enough people being literate and conversing about it, and the right people then, as Karen was saying, the leadership. And once we got, you know, the Chief Operating Officer at the CCG on board with it, and he started talking about it, as well as some of the people who are the kind of lower level managers, so that the kind of like the feed in and the feed down, feed up and down, was actually talking on the same language. And then at the board level, how we could kind of subversively, at almost any context, almost chuck in, you know, the kind of talk about the climate change and environmental factors, no matter what it was, whether they're talking about the new district nursing service or the new children's service or the new bill they're looking at in Broughton, we could chuck that in. And slowly, you notice that Whereas me and David McKelvey, the GP, we were the only ones doing it. Slowly over time, we weren't. There were other people who were chucking that in. You know, so is that building going to be carbon zero? How are we going to make sure that is? And me and David were just having to sit back and allowing other people to start taking that discussion forward. So, and I think then within practices, you know, that conversation can start having. We can share with each other those kind of things. And there's the Green Impact Toolkit as well, which we can start talking about in primary care. And people are like, oh, right, okay, brilliant. They want something to utilize to help them because they now understand what the impact is.
You're unwrapping loads and loads of levels there, both of you, that there's that cultural shift. Oh, is it just me? No, hang on. We're in this together. So we've got a collective push. We've got permission from the COO or the FD. And it tends to replicate itself. When people see things happening here, they can replicate there. And then it becomes a standing item for every discussion, from it being, what are they talking about this green stuff for, to, well, okay, can we have the climate and environmental impacts on that side of things? And funnily enough, that's not just a case with in the NHS. It's a repeating story across carbon literacy. Alexis, that sense of momentum, how, you know, are you seeing that in the other side of the Pennines?
So I think it is building, and we do, especially with the Greener NHS national agenda, that there's a glaring gap in the knowledge of stuff. We've got stuff on ESR, we've got stuff on PowerPoint presentations, but it's the one-on-one type of conversation that needs to happen. And we are building a momentum within the Yorkshire region. It's starting, and I know outside of the healthcare system, the likes of Sustainable Arts and Leeds, that they've got running massive big programs for ITV and BBC across the region. But within the health system, I know you had a speaker on earlier from Leeds Teaching Hospitals, who've become the first carbon literate organisation in the NHS, and it's something that needs to continue and build. We're getting more and more people on board. The ICSs are on this agenda as well, and we realise that there is this big gap in knowledge. But now all the toolkits are there, you know, there's no reason why not.
Indeed. Small correction, not to diminish from Leeds Teaching Hospital's amazing achievements on this. You know, they're the first hospital. To come on board, because there was an organisation, Northwest something, was it?
Oh yes,
Karen?
of course, yeah.
No, but again, this sense of momentum. And Nicholas, what you were talking about in terms of how the NHS is a huge influencer in any area as well, linchpin, obviously with a heck of a footprint, and how that can move. Playing to the whole thing of anchor institution. I can't believe what time it is. What I want to talk about now is carbon literacy, funnily enough. Alexis, did you take part in the leadership training that was done at Leeds Hospital last Monday?
No, I didn't, but I did the training with Karen well before Christmas, wasn't it, last year? And yeah, it's a really key aspect. I mean, being within sustainability, we know quite a lot of the stuff anyway, but it's how to approach it from a different angle, and it's inspirational as well.
So you can see that working. Nicholas, again, in terms of that impact, how do you? We've got a bunch of people watching now, and in the recorded version, if you were saying, well, you know, get on board with carbon literacy, I've seen this happen. What sort of things have you seen happen as a result of the training?
I think it's helped to focus the mind on the big hits. I think that's for me the biggest thing, that we started off with this whole just spreadsheet full of lots of different things that we could do, and we were doing, but it just felt very scattergun and didn't feel very coordinated or impactful. And when we started to kind of fine tune to what is going to have the biggest impact, that kind of helped to focus you a little bit, you know. And I think for me, that's been the biggest thing, to just find those top 3 things that will have the 3 biggest impacts and focus on those, because otherwise you'll get overwhelmed, you'll get lost, and you'll probably have little impact.
So significance. Anyone who's been through carbon literacy will know the significance word is meaningful for us. We ask that people design the actions that are most significant that they can do. Don't sweat the small stuff. Dare I say it, don't worry about plastic straws. Not for climate anyhow. But Karen, in terms of those impacts, what you've seen, you were talking about the impacts on your finance director. What else have you seen in the course of the training that you've delivered?
I think probably the biggest thing is ownership. So we talk a lot about action, but the biggest thing that we've seen come out of it is ownership. So on our first pilot, we had a lot of heads of departments, and they've basically gone away and they've taken ownership of what climate action means within their department. Some of those departments, such as fleet or estates, have basically committed, and facilities management have committed all of their staff to going through carbon literacy, so that, because they are the biggest footprint that we have across the organisation aside from supply chain, they're the ones that are going to be making the impact. Really, there's only so much that I can do as an individual, but as a department, if we're building to net zero standards, we need to have that ownership from the head of estates, from the estates managers, from the project managers, and they need to have that level of understanding. And we found that previously, having one-on-one conversations, they wouldn't really be willing to take that ownership. But since those who have been through the carbon literacy training, they are very much like, this is our responsibility. How do we build this into our workload? So it's not just about the two big actions, the two commitments that they make in the training. It's actually about how they take that forward in the long term.
So it's landing in a really tangible way for you. There's a
Yeah.
key message here. Again, two things. Many of the people watching, no doubt, will be sustainability specialists. And you all wear that tag in your various ways. Do you think it has an impact? And if so, in terms of broadening that, right, we'll throw everything at Karen, the bins, the monitoring and everything, and suddenly you've got more people on board, and your resources in a broader sense, delivering sustainability are strengthened?
I think so, yeah. I mean, I'm very much one of these people where if you throw something at me, I just kind of run with it. But you don't really want to be in a situation where you've got either a single person or a very small sustainability team, and the onus is on them to deliver net zero, because that's a big ask. For a single person within an organisation to be expected to deliver net zero without commitment from senior leadership or understanding across the various departments, that is a very, very big ask. So I think it's certainly helped to level the playing field here. It's certainly starting to feel like business as usual, which is what you want.
It is, and I always struggle with that. Making the climate crisis normal seems counterintuitive, but in terms of that message of mainstreaming it, absolutely right. Another thing that comes up consistently, I'm sorry, are you okay if we run, this is a good discussion, if we can just run a little bit further. The time issue. You weren't alone, Karen, amongst health staff going, a day's worth? Yeah, folks, this is a day's worth. You've got to be kidding, unless for light versions of that. How is that resolved? I call it the carbon literacy catch-22. You don't get that it's part of your job until you're actually carbon literate. Nicholas, could you pick up on that?
I think it's a double-edged sword. You know, on the one hand, you want to absorb people into that kind of area. You want to give them the time and the space for that general discussion, rather than just to sit back and just try and absorb everything, because it is overwhelming, and it needs to be done in almost in a gentle way, to build up, to give them time to process. But certainly in primary care, you offer a day's training and you will get very little uptake. So there's a great risk you just won't get the buy-in. I think we need to think about how we capture people's interest without putting them off, and maybe does need in some way of breaking down into smaller chunks over a period of time. But even that's tricky, but that might kind of help to lure people in and at least start getting them along that journey.
That's smart. Again, it resonates with my feeling that carbon literacy is almost like the second thing after people get some sense of, yeah, I need to do more about this. And some large organizations, including NHS England, who obviously have this mandatory sustainability and climate training piece that they're thinking of, it might be something that precedes carbon literacy.
We're looking at what a new starter, kind of module that maybe any new starter to an organization does some kind of basics, something that kind of gives them at least the kind of, the background, and then maybe different levels of that, that as people go along, they can do the more advanced level 2, the level 3, and hopefully over time, most people will have level 1 and 2 just as the basics, and level 3 will be more the, what are you going to do about it? So I think getting the new starters is your basic core. And it'd be like safeguarding, once you've been on safeguarding 1 and 2, you only ever do level 3 because it's presumed level 1 and 2. And hopefully we've got enough people doing level 1 and 2. Level 3 becomes the kind of thing that you try and lure people into.
Alexis, we also get this sense, I mean, the parallels with safeguarding have been made, even with health and safety. I was talking to a major corporate sustainability leader, quite gleefully said, yeah, a few decades ago, companies were killing people, killing their employees without any comeback, but making the parallel that now, of course, it's the norm. Do you think we're on track for that? Or if so, how? Let me rephrase that. How do we replicate that progress with climate engagement within the NHS?
I mean, looking at legislation and various things that are coming through, we're likely to have things like the health and safety. Looking at people that are working in diesel vehicles or working with Entonox or working with DES flooring, there will be a risk to health aspect. So there could be that kind of manslaughter element that goes with, well, you've known about this, you've known about diesel, we've known about diesel since the 1990s as being carcinogenic. So, putting people in harm's way through their own workplace, there will be elements that will be phased out through legislation, but also at the same time, if we go back to what every clinician has to do and sign up with Hippocratic oath, do no harm, it's mandated right from the word go that you come into any kind of clinical field, that you have to look at preserving life and various things. And climate change falls in the same category. So I think that there's been, with the announcement over the weekend of education being climate and carbon literate, it's, if we're going to get it on an international forum, and with the healthcare day at COP26 actually stating 45 countries have now signed up to the health agenda and coming up with net zero, we're getting there. It's going to take a long time, but at the same time we are miles ahead of many other countries. So I think we've got a real opportunity through this kind of education program to start off and educate everybody else in the rest of the world on this.
Fantastic. You've just done a fantastic closing statement, which is what I was going to ask you all to do. So Nicholas, closing words for people that are interested in taking this further.
I think identify your 3 big hits and focus on that.
Hey, that is pithy. Excellent. We like that. Thank you, Nicholas. And Karen, find words of advice for people seeking to explore or implement carbon literacy.
Probably my favourite that you've heard a few times already is to do first and apologise later.
Ask for permission later. Yes. Yes. Thank you very much indeed for joining us. I hope that that's done the job for people that are interested. There's another session coming up at 2 o'clock where we get into some detail. You'll actually get some hands-on with some of the material and see what on earth we've been talking about in actual material terms. Be quite fun, be quite hands-on. Thanks very much for joining us. Thanks to our panel, Alexis, Nicholas and Karen, and hope to see the rest of you at 2 o'clock. Many thanks.